Hi, it's Dr. Smith here again. Next I'm going to show you how I would apply kinesiotape to someone with a rotator cuff problem. Now, even though the name rotator cuff implies that this group of muscles and tendons rotate your arm, their most important function is to actually stabilize your shoulder. Now, these relatively small muscles start on your shoulder blade and insert into the upper arm like a cuff, hence the name. Now, most people think this injury is associated with athletic activity, but this injury occurs just as often in non-athletes. Rotator cuff injuries often occur as we age and the tendons begin to degenerate. But in younger people, it usually occurs from overuse, muscle imbalance in the shoulder, and poor biomechanics. Come to think of it, these three things are what cause the tendons to degenerate as we age in the first place. So you could say almost all rotator cuff injuries come from overuse, muscle imbalance, and poor biomechanics. Now, rotator cuff pain usually shows itself as pain among the muscles in the shoulder that are responsible for rotating the arm and lifting the arm. Pain is usually felt at the front and the outside of the shoulder or inside the shoulder itself. Now, symptoms include pain, weakness, raised shoulders, and decreased range of motion. The pain is made worse with activities requiring the arm to operate overhead or out in front of the body. Clicking, catching, or snapping are rare symptoms with rotator cuff injuries and may be indicative of other problems such as a torn labrum or a fracture in the arm. Now, it's very important to diagnose rotator cuff injuries early and take appropriate action to prevent permanent damage. Kinesiotape can be used during the healing process to create stability, relieve pressure, increase circulation, and relax the overworked or strained muscles. It's also very important to ice the shoulder after activity, and it's essential to rest the shoulder to combat inflammation and pain. After the initial healing process has completed, a strengthening program should be implemented. Now, please remember that kinesiotaping is designed to help enhance and support other treatments to the rotator cuff and is not a cure by itself. If you know someone who is suffering from these type of symptoms, they need to be evaluated by a licensed healthcare professional such as myself before they even consider trying to treat themselves with kinesiotape or any other method. Okay, next we're going to tape to support a rotator cuff injury or weakness. You're going to start with one of the longer strips. Tear in the middle and also tear at the end. You're going to start by applying the end down right underneath the tip of the shoulder, or you'll feel a little bit of an indentation there. You'll lay that tape down with no stretch. Then you're going to take the rest of the tape, peel the paper back. We want about an 80% stretch, back it off to 50, and then go 25. The stretch helps activate the tape, and you can come right along the back of the shoulder, just underneath the shoulder blade. You can use that as a guide as the angle that you want to come down along. So that's about a 25% stretch. Now what we're going to do is add some extra support to the rotator cuff muscles. So you're going to take your smaller piece, stretch it. This one we're going to go full 80% and across the back of the shoulder blade, right like that. And then finally we're going to do the same thing again. One more piece, 80% stretch. Get it on there. Ends with no stretch, that helps everything stick. Rub the tape, warms up the adhesive, makes it sure it has a better holding strength. And that's how we would tape for a general rotator cuff support. So now you've seen how I might support a rotator cuff problem with kinesiotape. If it is very difficult to lift the arm, or if there is pain, numbness, or tingling radiating into the arm, it's important that care is sought from a healthcare professional such as a chiropractic physician like myself, a medical doctor, or a physical therapist. Now, if you want to make sure you see our next video like this one, please like and follow our Facebook page. If you know someone who might benefit from this information, please like and share this video. If you have any questions, please leave them in the comments section below, and I'll try to answer them if possible. Thanks for watching.